Now, I'm not as cool as Melinda. I don't have as many great experiences as she's had, and I don't have the great expertise she has. So what I've actually wanted to talk with you about tonight is like the mistakes that I've made, don't repeat them. Because I learned very quickly the things that I thought were just very logical that don't work like you think they will. So I've been at the health department for about 2 years now. Like Chris said, I went from print journalism and moved over to PR because I thought that would be easier. Yeah, that's not the case, just in case you're wondering. So I had been at the health department for about 2 months, not only trying to figure out what a combined city-county health department does, but also trying to figure out what the PR world was about and how to make sure I was doing the best for my department. Someone walks into my office one day and they go, "Hey, we have something kind of going on. Do you have time to meet right now?" And I went, "Oh, okay, sure," having no idea what I was walking into. And we had been notified by a restaurant that they had an employee who was diagnosed with hepatitis A, which is an incredibly viral disease that is very, very easily passed. So in a food service world, that's very concerning for us. This was about probably 4 o'clock on a Tuesday, and I said, "Okay, let's do a press release," and they went, "No." And I said, "Why?" And so that was my first mistake. My first mistake, my gut reaction was, let's tell everyone about it. But my boss has said, it's 4 o'clock on a Tuesday, and if you announce to people that they could be sick, but we don't know who is sick or what time frame, and we have nothing for them to do, then you're not really helping them. You're not helping them understand. And 24 hours to figure out, for us to put infrastructure in place and to figure out who we're actually talking to is actually serving your audience a lot better. So my first word of advice is don't just jump to, let's be the first to tell the story. So in a lot of cases, I want to control that narrative. I want to be the first one to be telling people, this is the story, let me get it straight first. In this case, that wasn't the best option because we needed to know more. So we all agreed we're going to meet at 7 o'clock the next morning. Our restaurant inspectors went out to go talk with the restaurant. I will go ahead and say it's Red Robin. If you've been in the community, you know we're talking about Red Robin. The irony of all this is they're actually one of our cleanest restaurants that has no issues. This is one of those scenarios where a guy got sick and had nothing to do with whether that restaurant was clean or dirty or anything like that. People get sick. So our restaurant inspectors went out to work with the restaurant, figure out was there any kind of environmental issue there that we would need to close down the restaurant for that reason. And then another section of our staff went to talk with the sick individual about a health issue. People flip out about what they can't see that could be a risk to them. So I brought a bunch of people in, and a bunch of random people. I mean, I brought in the PR people that I knew that had jurisdiction and could come help me. I also brought in our secretary. At the time, I didn't have a social media manager, and so she became our social media manager for that day. And then I called the Office of Emergency Management. We recognized really quickly that we would need to put a phone bank in because there was no way our staff could answer phone calls from 5,000 people about really specific scenarios. My favorite one, the favorite phone call that I got, that we got in the call center was a woman, her bird gets a Red Robin burger every week. That's its treat. And oh my God, will my bird die? And that is not something that we had awkwardly enough prepared to answer. So that was one of the reasons we did a call center. Having everyone in one place so we could use collective knowledge of going, you're the expert, what can we do? I also got social media, or subject matter experts, because I am not an epidemiologist. I don't have that background, especially after 2 months, but now even 2 years later, I still don't have that background. So I wanted someone right there next to me, within my line of sight. When we started getting questions, we could answer right that minute. We called a press conference. At the health department, we do not call press conferences if we can avoid it. I believe very strongly in the Peter and the Wolf principle, which is if I am talking to the public, it's because you need to listen. It's a big enough deal that you need to pay attention. So we called a press conference. We told media there's going to be a health announcement. Come see us in an hour. With the idea of we didn't want to send out a press release with all the information because we didn't want it getting confused. We didn't want the message getting off track. And we knew if we got everyone in the same place and everyone got the same message, we'd have a much better opportunity to get the right information to the people right that minute. So that morning, I should go a step back. That morning we had that 7 o'clock meeting. We all know what we're doing now. We all know what the scope is. Okay, everyone divide off, come back in an hour, and we're going to reconvene and figure out what our next moves are. So we all come back in an hour. I have been focusing solely on the press release this whole time. I'm going to do the Cadillac of press releases. I'm so excited. We come back, and the first person to be called on from the Director of Health is, Kathryn, what's the communication strategy? And I just like deer in the headlights, no idea, but we're going to have a great press release. That was another mistake I made. Not having a strategy moving in was difficult because not everyone was on the same page about what our message was. Once we got past our messages, there are people who could be sick and come to us and we'll heal you. After that, there was no landscape. I hadn't told people what to say, which became an issue because my Director of Health is fantastic. He is a brilliant man and he loves to educate people, which 99% of the time is fantastic. Except when you're in a crisis and you need him to stick on message. I didn't give him a message. And so instead, he started talking to people about all sorts of philosophy and public health, which is great, but it just muddied the waters of what we were actually trying to get people to talk about. The other issue was, with numbers of this size with 5,000, our facility is tiny. Probably most of you have never even seen it, and you've driven by it a million times because it's so small, you don't know you've seen it. So we knew 5,000 people was not something we could have in our own building running through and giving shots for the immunization. So we went to another location that was essentially just a big warehouse, and we're moving people through. And my assistant director and I had a long conversation about, do we let media in that area or not? So if you're in a hospital, people don't get to walk into the hospital and take video if they want to. So he and I decided we were not going to let media inside, but we were going to put them on an exit, so if they wanted to talk with people as they're walking out, we're not going to keep them from talking with folks. The other reason we did that is because people are already kind of panicked, and they don't want their faces associated with a diarrheal disease. And so putting them in a big long line and then talking about, well, the symptom is diarrhea and explosive diarrhea. No one wants their face in the crowd behind it. People get really angry. They think they're on camera for something like that. So we had this strategy. We thought it was really smart. We opened the doors and let people in, and the Director of Health waves the media in and lets them just go crazy. And I just kind of froze as well. And I was really lucky that the people in local media got it. They got that when I came and found them and said, listen, we just want to make sure that no one who doesn't want to be in the shot is in the shot. They got it. That's where those relationships go back to. I was lucky that I was new to PR, but I wasn't new to the folks on the other side because I worked with them on the newspaper side. That they really understood that. They knew that I wasn't trying to control them. I was just trying to help our patients get through, deal with a shot that no one wants to deal with, and kind of move on. So the other thing that I want to bring up to don't be like me, I depended way too heavily on technology because I'm so used to having it in my hand and it's so efficient. So for the press conference, we have decided that the Director of Health be the one speaking, and I had given the press release long before, but I had his kind of main points, including the numbers and the dates and times of our clinics, were going to be behind him on a PowerPoint. And of course the PowerPoint failed. And so he went off memory of what our clinic times were and got it wrong. And because this was a huge deal, media were live tweeting it, and you can't take back a tweet. So we had people showing up an hour and 2 hours early because they saw on Twitter that was the time, even though that wasn't the time. The other issue is that everyone else who goes to this clinic has Wi-Fi capability. Everyone else could connect except me. And so I'm trying to send out hourly updates of here's who we vaccinated, here's the latest guidance we have, answer media questions, and I have no internet access. And so I'm trying to do all of this based on like the world's most ancient iPhone. So that was really frustrating. So my suggestion would be just have backups to your backups when it comes to internet. Know where the closest Starbucks or McDonald's is, so that worst case scenario you can run over, send some emails, and come back. And the other thing that I really did not consider and didn't, and I regret, so how many people, we gave them a phone line, a call bank, thinking everyone will call, everyone will want to talk with someone and will want to understand the issue via phone. you would be amazed at the personal health information that people will send to a general email address or will post on Facebook, on your very visible public page. We were inundated with emails and Facebook posts about very specific symptoms and concerns with what that was meaning and what can I do and where's the clinic and I don't know where that is and can you send me a map and I can't get there, can you pick me up, and just a whole range of things that had I been smarter, I would have had a social media person doing. That was actually one of my first hires after this was I need a social media manager. She handles our website and social media, and because we're government, like anything else, because if you have a skill, we have to take advantage of it. We have no money. You know, I've told you all the negatives, all the bad things. Overall, it went really well. We vaccinated around 4,000 people, which that's an amazing. There are always going to be people who aren't going to take it too seriously. There are going to be people who go to their own private doctor and want to talk to their doctor. We saw that especially with pregnant women. They wanted to go have that conversation with their doctors beforehand. So 4,000 is fantastic, and we've also become a case study of how you handle something in a 24-hour period. So I don't want you to walk away thinking like your health department super failed, because the department did great. But we would have looked even better and been more polished had I kind of thought of those things before.
Great. Does anybody have any questions?
The only other thing I will add, if I can do my spiel for a minute.
Please.
So figure out when he was symptomatic, which means when he would be potentially passing on that disease to other folks. So the next day we all meet and we start talking at 7 o'clock in the morning, and we discovered that he unfortunately was a really busy worker and was there all the time. And he also happened to work over Mother's Day weekend, which had a ton of people, and the people who are most susceptible to hepatitis A are elderly and young kids. And every little kid takes their grandmother to get a burger on Mother's Day. So there were 5,000 people that were potentially exposed in that time frame. And for a metric we use is for every person that is actually should be concerned, there's another person who has nothing to be worried about that just flips out. So we estimated 10,000 people who think that there's something terrible going on. And so my head exploded. And the first thing I did.
You get to be somewhere cool. You get a door card for a while. That's about it. So, but we do have those if anybody wants those in the news department or PR marketing. We kind of have a little bit of that. But obviously, I work on the other side. Like she said, I'm probably the person you don't want to piss off. And those relationships with PR marketing people can be very good, bad, hate, love sometimes. Both sides can get very angry about a story we do or something they wouldn't talk about, both sides. So it's something you always have to work on. I think either one of these gals would agree with. You gotta always be on top of it. And the best policy is always, in my mind, to talk. So if you ever crisis situation, or even before it, don't ever think, oh, no comment, no comment. That's the worst thing you could ever say to a news person, ever. That makes me think something's going on. Even if it's not, I think, oh, what do you hide? Now I gotta dig. And there can be something very easy, and these girls can probably tell you this too. There's your bosses and things you have to work with that may refuse to do that, but you always, from your perspective, need to encourage them to talk, to have something to say. Obviously, because I'm in television, my best thing is to talk on TV, which means you have to be on camera, and I think you're going to cover some things here in a minute, aren't you? So you'll want to. I was teasing one of my friends who's in PR marketing. She was saying that every day she has to come ready to be on TV and have a backup in her office of outfits and things you might run into. You always have to be ready just in case something happens. And she says the one day I'm not is the one day somebody will call for an interview, and I'll be like, oh my gosh, I have a run in my hose and my jacket's falling apart. So you always want to be prepared. What she said, earlier about a crisis situation, you want to have a plan ready to go. That's like the number one thing. No matter what business you're in, you kind of know some things that are going to happen. Health department perspective, you know there's probably going to be an outbreak of some sort. Let's just say there's anthrax. Let's just use that as an example. You know things like that are going to happen. So it's good to have a plan, fire drill, if you will, ready to go. Know who's going to talk and who isn't, so you're not thrown off. I can imagine she can tell you now she's got a plan ready to go. She's thrown off because that happened in the first couple of days she was there. She has a plan ready to go. If there's a crisis situation, she knows who to call. She knows who the experts are. She knows the media, which is another thing that's very important, is to be prepared beforehand, before something happens. Get out and meet the people at the stations, for example. I can't tell you how many, these two have not done this, but I can't tell you how many PIOs, PR marketing people we have not met. They just won't reach out at all. So if there's ever a crisis situations at those places of business, nonprofits, wherever they work, they're not going to know us. We're not going to know them. We're not going to know who to call. And we're not going to have that relationship with them. So it's not going to be good. So that's always best to reach out first. Food always works awesome. Just saying, newsrooms love food. Melinda will tell you that next week. Every time she brings an animal to the station to be on the midday show, she brings us bagels. I think she does it because the animals leave gifts behind on the floor of the studio. So I think it's a makeup for that, but don't quote me on that. But she knows how to win us over, if you will. I wouldn't call it a bribe per se, but being prepared is important. Talking. She mentioned she doesn't like to have news conferences. We prefer not to have to cover a news conference because it's kind of like this. We got one person sitting here. The background's going to be horrible. It's a whiteboard, especially for television. That's horrible background. And there's 50 people out here asking the same questions. They're going to have the same sound with you. We kind of prefer a one-on-one atmosphere if we can get it. It's time consuming for PR people though, because you would have to do back-to-back interviews, and that's something, if you have a crisis situation, you're not going to want to do that. You're going to talk once and then you're done. Maybe an update at the end of the day. What she also said about the crisis situation was the hourly updates. That's extremely important for news people. We're on Facebook, we're on Twitter, Instagram. We have all of our newscasts at different times of the day. 5 a.m., 11 a.m., some have noon, some have 4, some have 5, some have 6s, some have 10s. We all have 10s actually, some have 9s. So it's important to get those updates throughout the day. So if you ever have a crisis situation, you want to keep updated all day. She sends me an email, I'm going to be like, oh wow, I didn't even have to call her. Look at that. So she didn't get 50 calls from us because we know she's going to send them out hourly. That's being proactive about that. So that's good. Try not to, when you talk to media, don't ever lie. Just a tidbit. We've had that a couple of times this week, actually, happen with stories.
Well, you guys have always been good about, listen, I don't know, can I get back to you, is so much better than, oh, I'm sure this is what happened.
Yeah, no, that's a good tip.
Mm-hmm.
If you don't know, yes, say I'll call you back. I don't know the answer. Like she said, she's not a doctor. So some of these questions she's not going to know the answer to. So it's better for her to say, you know what, I got to call a doctor and get this straight. Let me call you back. And as long as she calls us back, because other people don't do that, it's good. And another thing to remember about the media and talking too is because of those nonstop newscasts, and she'll probably tell you this, we can call at 10:30 and we need an interview like within the next 30 minutes. It's not for tomorrow, it's not for next week, 9 times out of 10. It is for, I need you like right now, because we have a newscast and at 4 o'clock, and if I don't have my story done right now, I'm not gonna have a story. So you will feel incredible pressure from the media because of that. It's because we have a deadline, that's the only reason. But we know who to work with. We know like which hospitals are better than others. We know what schools are better than others. We have some that we will go to and go to and go to. Others we will not, because they have good PR people, which is good for just normal feel-good stories and crisis situations. You mentioned control the narrative. Be careful, control the narrative, don't control it too much. We know when we're being handled. We know when, well, in theory we know. We know when somebody's trying to go, oh, we don't want to talk about that hepatitis story. What, we got this story over here about backpacks that we want to do. Okay? Yeah, don't do that. Because then again, it's just like no comment. We wonder what's going on. What are you hiding? We're going to have to start digging now. So just to be as honest and forthright as possible, and you got it covered. You're good. Another thing to remember, I think a lot of people don't know this during a crisis situation, especially if you're working with police or hospitals or something. A lot of times people forget that media are also kind of first responders in those situations. We, especially if it's a tornado or something, we had a lot of reporters covering Joplin. Use another example, the Haley Owens death last year. We had to bring in a lot of counselors and things after those events for our reporters and people who were out there at the scenes. So it's important to remember that we do have feelings. We do get upset at these things too. So I think that's really important to remember from a PR perspective, is that we feel these things too, and maybe not in the example you had, but the Haley Owens Joplin tornado is a good example. And so that's something to remember. Our feelings too can be just as hot as somebody that was out there all day. It can be just as, and those tensions can go over sometimes, just like they can from business standpoints. So that's something to remember. And that's also, as a PR person, where you can step into. I was sent, excuse me, I was sent out, I don't know if you guys remember this last year, in Roanoke, Virginia. One of the TV stations had a reporter and a photographer who were killed. Somebody, a former coworker, just walked out there and shot and killed them. That was one of our stations, so they sent me out there for a week after that happened to the station to try and help them out and take control of the newsroom a little bit, to try and help them recover for a week. And the outpouring from all the businesses was just amazing. And that's something, as a PR person, you might not normally think of, but when something like that happened, to just see all these businesses gather, send a ton of food so that they didn't have to leave the station, send flowers so they didn't have to leave the station. It's easy to forget that, when something happens to them, it's just as important to be supportive of them as they would hopefully be to you and the community. So that's something to remember. Remember, in the media, remember your different media. Newspapers need something different than TV stations. Again, we want the on-camera interviews. I don't want a phoner. Ugh. I don't want a written statement. Ugh. Because that means I'm going to have to read it on air and just sit here and show it. Ugh. What video am I going to show? We love personalized stories. Okay? Like she was mentioning the health outbreak. If we could have got that guy, that would have been awesome. Would have been an awesome interview. Of course, they're not going to tell us who it is. But he could step forward. But we're also going to want those patients. Like she said, they allowed us afterwards, after they came out of the tent, to talk. We're going to want to talk to those people. No offense to her, we don't really want to hear from her. We want to hear from the people who are affected. We want to tell their stories. That's why if we go to like a Joplin or something like that, we, try and get the people. We're going to need the facts. We're going to need to know when the clinics are. We're going to want to talk to a doctor about what you need to look for. But 9 times out of 10, we're going to more want those personalized stories. So for example, if you're a PR marketing person for a nonprofit and you're giving somebody a bunch of money, we don't want to hear from you. We want to hear from the person getting money. So you'll want to set them up, have them at the news conference, have them do interviews afterwards with each station, have those people ready to go. And probably to summarize, one of the most important things, besides being prepared, is also asking after an event don't be afraid to ask the media how it went. I'll give you an example. We went out to Springfield Airport had that bomb scare I think it was last year. I'm losing track of time. Where they had the luggage and they had to take it out, blow it up, take it off. They immediately after that happened, the PR marketing person reached out to everybody and said, "Okay, how'd we do?" I was like, "Well, that's kind of cool. Nobody's asked me that before." And we had a lot of good feedback. One of the things I told him is I said, "You gotta have a place ready to go for news conferences." I gotta tell you, because when we got there, they couldn't decide where to put us. So we were started over here, then we moved over here. Then, oh no, we have too much media, so we're gonna have to go over here. And we had to move around, and we were trying to do a live hit for our 11 o'clock newscast, and we got screwed, I'm just saying. So
That
I
was
was like,
another mistake I made. I totally didn't think of that, and I stuck you guys in the parking lot the last minute, and that was terrible. Don't do that.
there's a little bit of noise in the parking lot. Yeah, that's kind of hard to handle. This kind of situation is much easier. Citizen seats where we can't get up. You have to remember that. We got to be able to shoot, so all the tripods have to fit over people's heads. There's a lot of things to think of that, yeah, you're not going to think of until it happens once. And then you'll be ready to go. And don't, try not to have trust issues. A lot of people have that with the media. They just automatically don't trust anybody. Give them a chance. If something happens, like with a reporter or somebody, don't be afraid to call their boss and go, "Hey, I had something happen," because I guarantee you the boss may or may not take care of it. I've had that happen a lot. We've been able to, change things, change stories, corrections. Everybody makes mistakes on both sides, so don't forget that, and don't, automatically because one thing happened, then close shop and, round up the people and say don't talk ever again. Hopefully that doesn't happen. So, questions?
Anybody have any questions? No, great.
Besides the free internship that you have to do.